Greetings everyone, I'm Judge Schlackman. I work as a mental health counselor, also as a hypnotherapist and energy healer. And for today's video I'm going to pose a question that people may wish to answer for themselves prior to seeking out therapy or any type of treatment or support for mental health concerns. And the question here is, which of these following two narratives and paradigms do you relate to or resonate with? And here's scenario number one. You are experiencing psychological distress or difficulties in your life, and you go to consult a professional for help and support. The professional has you fill in checklists of symptoms and then tells you that you have a mental illness and you will likely need to take a medication prescribed by a physician for the rest of your life to, quote, manage that condition. And then here's scenario number two. You're experiencing psychological distress or difficulties in your life, and you go to consult a professional for help and support. The professional seeks to get an in-depth understanding of you and your life, including the various stresses, traumas, and challenges that you have faced and how you have reacted and adapted to those challenges, and how those patterns may be creating distress and dysfunction in your life. The professional explores with you your lifestyle, including diet and sleep patterns, substance use, social relationships, and career satisfaction. That professional explains that there are a variety of ways to support you becoming a stronger, wiser, healthier, and more balanced and resilient person, and to help you heal any trauma or unhealthy patterns that you have carried from your past. If you resonate most with scenario number two there, then the holistic therapy approaches that I provide in my healing work might be a good fit for you. Whereas if you resonate with number one, then you would be inclined to consult probably a psychiatrist, as that is the model of practice that much of modern psychiatry follows, where they're not spending a lot of time to in-depth explore a person to understand that individual and his or her life. They're just providing a diagnosis and using a pharmacological model of treatment, where the first thing you do is hand out a medication prescription without really considering the potential harm or drawbacks to doing that. If we think about what's creating or triggering any psychiatric or mental health symptoms, there are psychological and physical factors that may be involved, but the physical factors would tend to involve things like lifestyle and diet, sleep patterns, some of the medications a person may be taking, both for physical issues and mental health issues. Those can actually create mental health symptoms. So there's some of the variables on the physical level. It could also include toxins in the environment, infections, exposure to mold or other contaminants in a person's living environment. So all of that could contribute to mental health symptoms. And then you have a lot of different psychological factors. You have the person's childhood development, So the attachment environment, how that person navigated any neglect or abuse that they may have experienced, how they adapted to it, what protective mechanisms were strengthened or built up for that person. So all of that is relevant, and giving a person medications actually treats none of that. What it's doing is kind of compensating for or momentarily covering over whatever the reality is. It's creating a kind of chemically induced stimulation or suppression of mental and emotional activity. And by using that method, by using chemicals to stimulate or suppress a particular mental state, you're not helping a person build resilience. You're actually kind of programming them to have a dependency on some external chemical to regulate what they're feeling in the moment or where their mind is focusing in the moment. So it's not building inner strength or inner balance. It's not building skills to manage one's own emotions, to manage one's own mental focus or state. And it's not providing any form of actual nutrition or nourishment to help the body better handle stress. It's just giving a short-term chemical manipulation to create a desired state, but that state can't last. When it wears off, when you withdraw, you could easily end up in a worse state than you were to begin with, and then that could lead you to want more of the drug to override that again, and it becomes this kind of vicious cycle that too often leads to dependency or addiction to the medicine. So as a holistic therapist, I'm seeking to look at the whole person, at their whole life experience, and to understand what is actually creating or causing the symptoms they're experiencing. What is the root or origin of that pattern of distress? And there are many different ways to provide some type of therapeutic support to address those actual stresses or actual issues that have led to the person's challenges. So if you are looking for mental health care, I encourage you to consider that question I posed at the beginning of this talk, to see which paradigm and which narrative you relate to or resonate with, and to consider what approach or paradigm or philosophy the professionals that you're going to consult are using in their practice. If you're looking for long-term health and well-being and resilience, just going to a doctor who's going to hand out a prescription for a medicine to you is not providing that type of long-term solution, that support for you to build your own inner strength, your own skills for navigating life, rather than medicating your chemical state. For those that are seeking healing resources and support, you can visit my website to learn about the therapy services that I offer. The website is phinsights.com. That's phinsights.com. For now, I would like to wish everyone a wonderful day. Namaste.